Hi, I'm Dr. Michael Fragner, and this is Living Your Best Life with Heart Failure, Module 9. In this module, we'll be discussing ways to control your heart failure via medications, devices, procedures, or surgeries, smoking, cessation, lifestyle changes, cardiac rehabilitation, and stress control, as well as all other factors that may come into play regarding heart failure. For medications, it's very important that you take them exactly as you were instructed. These medications are tailored specifically for you and your symptoms, and you and your provider have come up with this plan together to help tailor a regimen specifically for you. Devices for irregular heartbeats, these implants. One is an ICD or a defibrillator. This protects against dangerous arrhythmias, and it shocks the rhythm back into a normal rhythm if you were to go into one of those dangerous heart rhythms. Pacemakers, these allow the heart chambers to beat together and synchronously to help produce consistent blood flow and ejection to the rest of the body. Procedures and surgeries. One procedure is stents. These are for narrow arteries to open them back up. Coronary bypass surgery. This is when artery blockages are too complex for stents, and this is a surgery. And heart valve surgery, either repair or artificial valve placement if you do have a dysfunctional valve. And cardiac rehabilitation is a supervised fitness program that has shown to really improve patient outcome and patient functional status in heart failure. Lifestyle changes. So for diet, eating less salt is very important, as salt can increase the fluid in your body, making your heart work harder. Asking for low or no salt when you're eating out is something that you can do to help stick with this plan. Limiting alcohol and fluids. Alcohol can weaken the heart muscle and can increase the risk of arrhythmia. Eating lean meats and poultry, 4 to 6 ounces per serving. The size of your fist is a good gauge. And eating oily fish at least 2 times per week. Maybe for some people, maybe not, but this is something that could help improve your diet. It increases omega-3 fatty acids, which can reduce coronary heart disease, and avoiding processed prepared foods, of course, which are high in sodium and trans fats. Other lifestyle changes, physical activity, of course, critical for improvement. Speak to your doctor. You may need to avoid on days of increased fluid, or if you're not feeling well, and they can help you set up a program as well. Smoking cessation, so stopping of smoking. It's terrible for you. It's linked with heart disease, lung cancer, stroke. Stress control. Increased stress can increase or worsen our heart failure symptoms, and you can improve by relaxing in your own way. And this is different for everybody. It's a very complex thing, but stress can worsen heart failure and symptoms. And support. This disease can become isolating. So there are support groups out there. Talk to your provider, family, friends. It's always important to have someone to lean on. For caregivers, caring for a loved one with heart failure is a lot of responsibility. Talk to your doctor if you're dealing with stress and anxiety. Eat healthy, exercise, make time for yourself. You can't take care of someone if you can't take care of yourself. I know it's a cheesy statement, but it's absolutely true. And create a support team of family, friends to relieve duties so you can tend to your own needs and take care of yourself. Symptoms of depression, not limited to this slide, but if you're having difficulty concentrating, feeling tired, guilty or hopeless, difficulty sleeping or sleeping too much, appetite loss, sad or anxious, thinking about suicide, depression can become as physical as it is mental. So if you are experiencing these symptoms, please speak to a provider, speak to someone, and absolutely seek help. Symptoms of anxiety, uneasiness, difficulty sleeping, antsiness, muscle tension, and more. Like I said, this can absolutely become a physical thing for you. And then caregivers, asking for a second opinion of your loved one's treatment. There are new trials out there, there's new treatment. There's different rationales regarding treatment plan between different physicians. So you're absolutely, within your right to take care of your loved one as best as you see possible. And if that's seeking a second opinion, absolutely do it. An advanced care plan. So what is it? It's a written document that ensures that the medical team adheres to your goals. And what does it cover? It covers resuscitation, so um, reviving if the heart stops breathing, a mechanical ventilator, breathing for you if you needed it, pain relief if that becomes an issue, how you'd want to go about that, and how other medical complications will be handled if they do occur. And this includes advanced care directive, living will, power of attorney, and a financial plan. So we'll go through those quickly. An advanced care directive is guidance about future medical care, written documents. Do not resuscitate, do not intubate, what healthcare providers should do and not do when the heart stops beating or if you stop breathing. It's just something to think about in regards to what your plan would be. So if it ever does get to this situation, your wishes can be fulfilled to your wish. And living will, legal documents about wishes regarding life-sustaining medical treatment should you be unable to communicate, and a healthcare power of attorney. This allows someone to make all healthcare decisions on your behalf if you're unable to make that decision for yourself. It can be guided by your living will if you have one, and you're able to make decisions thought to be, and most importantly, in the best interest of you. So talking with your healthcare provider, ask questions about your specific disease. How is my heart failure progressing? Is my heart failure responding to treatment? What can I do to improve my quality and length of life? How can I tell if my heart condition is worsening? These are all great questions to ask. I'm going to ask yourself questions about your goals. This may include, what does quality of life mean to you? What are your hopes for the future? What are you most afraid of? What gives you the most meaning? And what heart failure symptoms bother you the most? I think having asking these questions for yourself helps create goals and helps create standards, and you're able to have a more fruitful conversation and care plan going forward. So thank you for listening. I hope this was helpful, and take care.